Good afternoon. This is TTT Live, Chalk City 91.1 FM and TTT Live online on Facebook. I'm Dike Rostant with your TTT News Update. Member of Parliament for Laventille East, Movar, Adrian Leons, says residents of the area are anxiously awaiting justice. He made the comment while speaking on TTT's Now morning program.
Right now, people are more or less being patient, in terms of the outcome. There isn't a relief or persons just say, okay, well, we done, It's more of, okay, the authorities are stepping in, investigations are happening, and we're hoping for a speedy outcome of what is going on.
In other news, National Security Minister Stuart Young says government's decision to repatriate Trinidad and Tobago citizens has nothing to do with the upcoming general elections. Minister Young was asked about the possible link between the exemption application process and the upcoming polls during the Ministry of Health's media conference on Monday. He denied that the government is attempting to prevent anyone from returning home. The National Security Minister said government's decision to repatriate citizens was about saving lives and not about the elections. Minister Young says he empathizes with persons stranded outside of Trinidad and Tobago, but the pandemic is still a concern and cannot be taken lightly. The National Security Minister added that Caribbean Airlines will repatriate 28 persons from Cuba and 20 from St. Martin this week. He has called for patience as government continues to manage the process of bringing citizens home. In other news, COVID-19 has brought home the changed behavior of social or physical distancing. Now, this understandably raises questions about procedures such as hospital and clinic visits, even though the Ministry of Health has gone to great pains to explain the parallel healthcare system. Now, Dr. Che Bowen created a telemedicine platform bridging doctors with people who do not want to or cannot leave their homes. It was created in 2018 and is called MDLink. We have the doctor on the line. So we say good afternoon, Dr. Bowen, and looking at it now, did you think that MDLink would be this necessary?
Hi, good afternoon, Mr. Rostant. MDLink, when I started in 2018, I was thinking of to build it more for convenience. However, as COVID-19 came about and we saw that social distancing became a need, everyone had to stay home, even the elderly, those with serious chronic conditions were requested to stay home. Telemedicine moved from a convenience to more of a need, and we did see an increase in the amount of usage from patients and doctors, both doctors realizing that they need to use telemedicine to see their patients, and patients realizing that they need to see their doctors safely from home. And that's where MDLink came in perfectly as a solution for the COVID-19. We initially launched in Jamaica, however, we recently launched in Trinidad and Tobago, and we do have doctors available on our platform in Trinidad and Tobago. We have partnered with some pharmacies and will be delivering prescriptions electronically. And this again is in an attempt to flatten the COVID curve. So telemedicine increases access to affordable healthcare and increases your safety and keeps you safe at home, prevents you from spreading the disease or even being exposed to the coronavirus disease.
Now, thanks for giving us an overview. So we know what it's supposed to do, but how does it work? How do I access it? Okay, well, I want to make use of MDLink. What do I need to do?
Good question. So registration is free for both doctors and patients, and you can register online, www.themdlink.com, or you can register on MDLink Health. The MDLink Health app, you can download that and you have access to see your doctor. You simply select Trinidad as your location, and it will show you all the Trinidadian doctors and relevant participating institutions, such as labs and pharmacies. You pay online. Payment is done online, and you see and visit the doctor and diagnose and treat it all online on the telemedicine platform. It's the first of its kind in the region, and we're happy to bring it to Trinidad.
But who is the target? Is there a special type of patient? And I ask that because there may be some, or let me ask that conversely, is there someone that this is not for? Is there someone that you would say, okay, well, you need to physically go to your doctor?
Yes, definitely. Again, excellent question. So there are a lot of conditions that we do treat, as well as a lot of conditions that we do not treat. For instance, if you had head trauma, loss of consciousness, bleeding, these are conditions that chest pain even is not something that we want to manage on the telemedicine platform. So we would immediately refer you to the necessary institution, which in this case would be a hospital or a in-office experience.
So with that in mind and saying, okay, well, these are the things that we're dealing with, or rather, these are the things we're not dealing with, how far, what is the scope of MDLink? Because you spoke about saying, okay, we're starting in Jamaica in 2018. Right now we're speaking, I'm in Trinidad and Tobago. Are there other areas or other jurisdictions in the region that MDLink is starting to address, offer services to?
All right, great question again. We're trying to expand through the entire Caribbean region. Right now we are firmly located in Trinidad and Barbados, as well as the Cayman Islands. We have doctors in Antigua, in St. Lucia, in the Bahamas, in the British Virgin Islands as well. And we will continue to access to affordable healthcare, something that the entire region needs. In terms of where MDLink wants to go in the digital health system, more or less we want to bring remote patient monitoring, so conditions like diabetes and high blood pressure can be managed in entirety from home. And we recently launched a COVID artificial intelligence screening tool, which again is free to the public, and you can simply log on to www.vtemdlink.com and access that COVID AI chatbot. And what it does is it screens you and it lets you know whether you're high risk or low risk for the coronavirus disease, and if you should go to a medical facility or receive testing.
Dr. Bowen, I want you to give me an example of a run-of-the-mill, for want of a better term, procedure that can be done by MDLink. Is it that I have high blood pressure and I normally go in to check it, so I can do this via this service? What are some of the things that you'll currently treat on a very regular or consistent basis?
Right. So we focus on conditions, again, that are telehealth specific, that fall into the telehealth protocols, which are common conditions like the flu, allergies, rashes, mental, again, allergies, urine infections, sexually transmitted disease, a lot of these common conditions that can be easily treated and managed without a physical examination. We also do prescription refills.
How does that work? In terms of saying, okay, well, I'm getting a prescription from you, seeing that if I'm going into a pharmacy with a prescription, the pharmacist would want to see that form or that signature. How does that take place?
Correct. So we have a delivery system set up as we move towards e-prescriptions, which is done, of course, in the first world, and we're trying to change the system to modernize healthcare. We'll be delivering the handwritten ink prescriptions to the respective pharmacies when necessary.
Okay, sadly breaking up on me a little bit, but my final question, what apps, or is it for specific devices? Do we download the app to be able to make use of this service? Because sometimes people have Android and not something else. How do people avail themselves of this service?
Right, so it's available both on the App Store and the Android store. So that is MDLink Health. You can simply search for that. It's free to download. You can check it out, and it's available in Trinidad. That's the most important thing.
All right, so we want to thank you so much, Dr. Trey Bowen, keeping us in the know about MDLink. And remember, on your app, you check MDLink Health. And once again, thank you for the work that you are doing. Also reminding you that you can join us for live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live online for all your updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant. Bye for now.